Welcome to Uniquely Qualified. I'm your friend and host, Liz Ficken, and I'm so glad you're here. Uniquely Qualified is a podcast that empowers guests to share their experience, strength, and hope in overcoming challenges in the spirit of mutual healing. We hope that you'll leave feeling more aware, connected, and supported in navigating the human experience. Today's episode discusses pregnancy and traumatic birth. Please take care of yourself and engage as it feels supportive. So this is one of those episodes where I just want to ground listeners in data before I introduce my guest. I feel like a lot of us, myself included, we're just unaware about the risk of pregnancy and childbirth until we or someone we love encounters a trauma related to birth or pregnancy. So I'm here to let people know that even if you or your family hasn't had a traumatic birth experience, you probably know somebody who has. So I'm just going to take a few minutes here to paint by numbers using data from credible agencies, specifically the Center for Disease Control and the World Health Organization, to back this up. So first of all, across human history, childbirth has been the #1 cause of death for women, period. And according to data from 2022, for every 100,000 live births in the United States, there are 22.3 maternal deaths. And the Center for Disease Control defines a maternal death as the death of a woman while pregnant or within 42 days of termination of pregnancy from any case related to or aggravated by the pregnancy or its management, but not from accidental or intentional causes. So if we break down those 22.3 maternal deaths by race, the rate for American Indian and Alaska Native women is 50.8 deaths per 100,000 live births. For Black women, it's 49.5. And then for white women, it's 19. And for Hispanic women, 16.9. And Asian women, 13.2. Again, this data is from the CDC from 2022. And it highlights something that I just feel is super important to call out at the top of this episode, which is that when we're talking about birth trauma or medical trauma from birth, Native, Black, and poor women all experience these things at a much more prevalent rate than white, Hispanic, and Asian women. And according to the World Health Organization, 95% of maternal deaths worldwide occur in low and lower income countries. And 75% of the women who die are from one of these reasons. They have severe bleeding, mostly after childbirth. There is an infection that takes place also after childbirth. There's high blood pressure during the pregnancy, which can be called preeclampsia or eclampsia. There can be complications from delivery and unsafe abortion. So those are the top 5 reasons why women die in childbirth. And so while this episode is intended to focus on birth trauma and recovery, it felt really important for me to help people understand just how deadly pregnancy and birth remains in our modern era. But here are some specific facts about birth trauma. In the United States, 45% of all births are considered traumatic. And if you're like me, hearing 45%, that's a huge, huge number of families that are impacted by birth trauma. According to Medical News Today, birth trauma refers to any physical or emotional distress experienced during or after childbirth. It can range from mild to severe and affect both the birthing parent and the infant. It can be mental and it can be physical. So for example, a physical injury may look like nerve damage or a perennial tear, and emotional distress can manifest as post-traumatic stress disorder or PTSD. And on that note, parents who have experienced birth trauma, about 17% of those people have PTSD. So in summary, pregnancy and birth can be incredibly risky, and a significant portion of birthing people experience trauma. And so if you're one of those people, please know you are not alone, even if it might feel that way. And my guest story today is going to validate that you are not alone. So on that note, I would like to introduce my guest. This wonderful woman has been a dear friend of mine since 2007 when we met at Chapman University and pledged the same sorority. Taylor, welcome to the podcast.
Thank you, Liz. It's so good to be here.
And thank you for all your support. You've been such a cheerleader for me in starting this endeavor, and I'm just really glad to have you on.
I'm just so glad that this is happening. I'm so happy for you. I'm so proud of you and all of your guests, and I'm really honored to be here.
Oh, thank you. That means a lot to me. So for our listeners, if you don't have the privilege of having known Taylor since 2007, she lives in California with her husband Corey, their son, and their dog Dolly Pawton. Pawton. It's just so cute. I'm sorry, I had to spell it out. Prior to becoming a full-time mom, Taylor was a middle school teacher. She enjoys true crime, attending live music shows, traveling, and trying new recipes. So Taylor, question I ask everybody, what makes you uniquely qualified?
I am uniquely qualified to talk about birth trauma.
Yeah. And I'm sorry that that's what makes you uniquely qualified, but I'm really grateful that you're willing to come and chat with me and our listeners about what you've experienced. But maybe before we get to that, I would love it if we could take us a journey back in time and talk about meeting Corey. Do you mind telling us just the story of how you guys met?
Yeah, of course. So it's actually a funny story. I did technically meet him one time before our official meeting, and it was via a friend who was picking him up. I was with her and she's like, "Do you mind if we go pick up my friend from a party?" And I'm like, "Yeah, sure, whatever." So we go pick up this guy and this other guy, and I don't know who they are. And that's really the only thing that happened. And then a couple of years later, so that was sophomore year, senior year, I end up being in the same class as Corey. And I notice him from across the room. I'm like, that guy's pretty cute, but I'm honestly at this point, like, not even thinking about anything
Mm-hmm.
having to do with dating. So it just, you know, that's not what I'm thinking about in that moment. And the second class that we ended up having together, I saw him when I came out of the building, and he was just kind of standing there and he made eye contact with me, but he was on the phone. Again, didn't think anything of it. I just was like, oh, interesting. I made eye contact with this person. He's kind of cute. And then I'm walking to my car. And as I'm in the underground parking structure, which is not a place that you want to be while you're alone and a young woman, um, I hear this, oh, hey. And I know so many people at Chapman, so I just assume it's someone I know. I turn around, it's this guy. He introduces himself, and actually at that time in my life, I was going through some stuff, and the
Mm-hmm.
class that we were taking was called Sociology of Death and Dying.
Mm-hmm.
So he starts a normal person conversation with me, to which I reply with like probably like a over explanatory trauma response to something that we talked about in class. And I was like, this guy's never going to talk to me again. Um, but a week later, he did talk to me again. And he asked for my number, and we ended up going on a date that week. And it was just like the best first date ever. It was so chill. We ended up agreeing on, we both found out we had the same favorite coffee spot, same favorite taco spot, both of which were not even near campus. Like they were in another city. So it was just kind of funny that we serendipitously liked those same places. And yeah, that's how we met. And then we were together for many, many years before we got engaged, which was sort of our choice. We wanted to wait until we were pretty much ready to have kids before we got married. Like we wanted to
Mm-hmm.
mature and sort of like go through our 20s and then do all the serious stuff. Um, so a lot of times people hear like, oh, you dated for like 9 years before you got engaged. Like, were you mad about that? I'm like, no, that's exactly what I wanted. Like, I'm very
Mm-hmm.
happy. Um, so yeah, that's just kind of the broad overview.
Mm-hmm. I love that. And I know that on this podcast we talk about serious things, but I have a really hard time not like laughing and smiling a bunch when I think about 2010 you guys and your meet cute story. It
Yeah.
just and thinking about your husband, I smile. He's just like such a nice guy, and You guys are such a great couple. And I love that I personally love that you waited so long. When you met him, I remember we were both feral in our early 20s, feral in the streets of Orange, California. And I just remember being like, oh wow, this is a really great guy. But like I don't know if Taylor ever is gonna settle down. Like it was
Yeah.
just like not
There was
like
no chance at that point.
commitment. Right, right. And
Yeah.
so it always made sense to me as your friend that it was like, let's just like really make sure we're sure. And
Hmm.
I didn't realize that you were waiting to be closer to having kids, but that totally makes sense.
Hmm.
So you date throughout your pretty much your entire 20s, you get engaged, and then you got married in July of 2021.
Hmm.
And so you basically just like have been building a life together, and you both always wanted to be parents, right?
Right. Yeah.
Yeah.
Definitely.
So can you take me from you get married in July
Hmm.
to like when you get pregnant, just like walk me through that
Hmm.
timeline for between like I said, marriage and then you find out that you're pregnant. What happens in between there?
Yeah. I mean, so much life happened in between. Honestly, it's crazy in the first year. We had a lot of happiness. We had a lot of really good moments in our first year of marriage. And then we were actually hit really hard with a big loss in our
Mm-hmm.
family right before I found out that I was pregnant. So that was just kind of like, it was good and bad timing. It was weird timing. Let's call it weird timing
Yeah.
because obviously bad because you're going through this horrible situation and you're wishing that this person was there to experience your happiness and your joy. And it's just like not fair that that's not the case. But
Mm-hmm.
also good because a horrible thing is happening. Now you have something to look forward to and something to give you sort of some hope. So
Mm-hmm.
um yeah, it was just
Mm-hmm.
weird timing. And I think for I mean, there's many reasons why I waited to tell a lot of people, including my family, that we were pregnant, just and that's a big one of them.
Mm-hmm.
The other reason why we didn't tell people for a long time is we didn't tell people until like into some point into the second trimester, which I know is pretty normal, but I also know of a lot of people who want to share a lot earlier because they're excited. So to
Yeah.
each their own.
Mm-hmm.
Um, but it was mainly that. And then I know that on one of your other episodes, you talked about the prevalence of miscarriage. And I
Yeah.
was just like so terrified that that could happen to me because I know so
Mm-hmm.
many people who had that experience. So I was just like, you know what? Let's just keep this a private thing for as long as we
Mm-hmm.
can. So then by the time we were ready to share, it was like more exciting and there had been some distance between all the stuff that happened. And there wasn't like this big fear that something bad would happen. So
Mm-hmm.
that's what worked for us at the time.
Mm-hmm. So I asked another one of my guests this same question that I'm about to ask you. Um, and it's just interesting to think about. So when we experience grief and joy at the same time, it almost seems like they're both amplified. Was that your
Mm-hmm.
experience, or is that out of bounds from how you
Um,
processed?
that's a really good question. I think at that time, instead, I almost feel like I may have had the opposite, where like I almost felt very numb
Yeah.
um, in a way, but I can totally see what you mean by that. I think
Mm-hmm.
there are certain circumstances where that would be true, but I think because it was just so much that my nervous system response was like numbness and kind of being in, like shell shocked a little bit, you
Yeah,
know?
totally, totally.
Yeah.
Yeah,
Hmm.
that makes complete sense.
Hmm.
And it also makes sense that you would want to. And you and Corey are also like you're open with your friends, but you're also pretty private people, like with like the big things, if I'm not mistaken. So I it makes also
Hmm.
makes sense to me that you would just wait until you were getting. I'm imagining healthy indicators from doctor visits and stuff like that. Is that on
Hmm.
track?
Yeah.
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 And so tell me a little bit more about what the pregnancy was like. Was it typical, atypical? What was it like for you?
Um, I was actually pretty fortunate for most of the pregnancy. I wasn't like extremely ill or extremely uncomfortable. I was okay. There were moments where I, of course, did not feel well, like everyone experiences when they're pregnant at some point. Um, for me, the hardest part was the end of the pregnancy because I was so large and I gained so much weight, and baby was very big. So like I physically could barely walk at some
Hmm.
point. I had really bad like pelvic pain. Um, just all of the uncomfortable things, and everyone's different. So some people will say like, oh, the first trimester was the hardest. It was horrible, but like the third was not so bad. So like that's been interesting too, just seeing how everyone's experience is very different. And I
Right.
guess in terms of like atypicalness, I still don't fully understand this, but I had something that was called a two vessel cord.
Hmm.
So I don't, again, don't really know what it is because it didn't really affect me negatively. So I was like, it's fine. I don't need to know more
Right.
about that.
Right.
But there is this circumstance that I don't even know. It's a very low percentage of women who have a two vessel cord instead of what you're supposed to have, which is a three vessel cord. And it can result in the baby being underweight or below average weight. But a lot of times it doesn't have any effect. So for me, it didn't have any effect, but I did have to do more ultrasounds and check-ins and
Oh, okay.
non-stress tests because of it, even though everything was fine. It's like a precaution. So I had that. And then of course, the entire pregnancy, my son was measuring well over like what the typical size was. So
Hmm.
those were kind of my two atypical things. But overall, having discussed pregnancy with a lot of other friends who went through it, like I feel
Hmm.
pretty fortunate. Um, like I was able to keep my symptoms pretty much manageable and under control until like the very end when
Hmm.
I was like extremely uncomfortable. So
And
yeah.
then for our listeners, the reason I'm laughing too is that like, so punchline, we have a 10-pound baby is born.
Hmm.
Not to jump ahead in your story at all, Taylor, but I'm smiling because I'm remembering it like the 4 month mark. I think when you told me it was like baby bump, oh my gosh, I'm so big. And then like when you were like 38 weeks pregnant, I just remember opening up my phone and being like, oh damn girl, like that is gonna be a big baby. Look at you, healthy mama.
Oh
Um,
yeah.
so
I always
it's
said that he was living in his, because I'm tall and I have a long torso. And I knew that we would genetically, like, I knew I was bound to have a large child anyway. Like, it wasn't a surprise, but I always joke that he was living in his like 2-story condominium in there and he like didn't
yes.
want to come out.
Yeah. I love that. So cute. And I'm glad that you didn't have a bunch of those really uncomfortable things that people often have with pregnancy. Like some people just
Hmm.
have brutal cement like trimesters. So I'm
Hmm.
glad that you had a pretty normal pregnancy, aside from the two vessel situation. I don't. It's called
Yeah.
a two vessel two.
I think I think at the time I did some research and actually understood what it was, but now it's been so long and I haven't thought about it because it never like did anything. Like it, I'm
Yeah,
sure if it caused problems, I would have known more about it. But
right. Where it's like you clearly didn't
yeah,
have an underweight developing baby,
no,
so it's like
that
okay,
was never a
that's
concern.
right.
Yeah.
Is there anything else you want to more you want to share about your pregnancy or what that was like for you before we get to your birth?
Um, I guess, I mean, there's things I could talk about, but they might be things that you want to discuss later, like the role of just like societal influence and social media and stuff. We could
Yeah,
talk about that a little further on if
let's
you want.
um maybe we get into that a little bit now. Like things that are going through my mind, um, like having a birth plan. Did you have a
Hmm.
doula? Did you have an idea about like this is what I want my birth to be like? And if so, what influenced that?
Hmm.
So like maybe mindset and
Right.
perception prior to everything happening.
Hmm. So this goes way back to when I was in college. I watched a documentary called The Business of Being Born,
Mm-hmm.
and it is essentially about just the power of the female body to give birth naturally and how our bodies are meant to do that. And it doesn't need to be a scary thing, and it can be a beautiful thing. It can even be a blissful thing. It doesn't have to be like this painful experience. And there was like a lot of live birth footage and a lot of research thrown into it. And I just thought it was fascinating. So even since college, I always had this belief like, if I get pregnant one day, if I have a baby, I could totally do it. Like my body can do it. no matter what. I just had this very um, small view of like
Mm-hmm.
what that would look like. And I had known some people who had like had a natural birth and it was beautiful. And then, so that's like what I wanted. And to be clear, I wasn't like anti drugs and epidural and stuff. Like I was like on board with whatever needed to happen.
Mm-hmm.
But I went into it thinking like my body can do this, no excuses, like it's going to happen, it's going to be great. Um, I started following a bunch of accounts on Instagram that were all about like the natural birth community and seeing all these like positive stories and surrounding myself with that, which I mean, in a way it was nice because I was like not scared, you know.
Yeah. Yeah.
That was helpful in a way. It was also hurtful in a way, but it was also helpful.
Yeah.
um, so that's kind of what I surrounded myself with. And um, I guess I knew in my heart of hearts, I had this feeling that it was gonna, even though I had a positive viewpoint, I had this like gut feeling that it was gonna be really difficult as well. Even though I knew I could
Mm-hmm.
do it, I was like, it's gonna be really rough. Only because I knew that my mom had a long labor and that I was a large baby as well. So I was like,
Mm-hmm.
usually, I think it's usually kind of genetic, like however your mom's birth goes, like could sort of dictate how yours goes.
Okay.
Not always, but like it can
Yeah.
influence that.
Mm-hmm.
So I had that in my mind. And then I just had this gut feeling when I was preparing and getting all of the materials that I might need for postpartum healing. I was like, I don't know, I might have to have a C-section. Like I just had that thought, even though
Yeah.
I was like pretty confident, but I was like,
Yeah.
what if I like need different like materials than what I'm planning to get? Like maybe I should hold off and just see. So I like kind of knew in the back of my mind like for that anything could happen.
Yeah. Right.
And when I was preparing my birth plan, I pretty much said I mean, I had certain preferences, um, like certain little details that I wanted that I don't need to go into because they're like minor things. But overall, my plan was, of course, I would prefer a vaginal birth. That's like my dream, my goal.
Mm-hmm.
It's something I've dreamed of doing my whole life, like having that empowering moment of a vaginal
Mm-hmm.
birth.
Mm-hmm.
But I did indicate if that's not going to happen, I don't want forceps or vacuum.
Mm-hmm.
And part of that was because I knew that baby was going to be very big. And
Mm-hmm.
sometimes, I mean, most of the time, those options are great and there's no problem. But I was just nervous that I might be introducing a situation that would make things worse if baby got stuck.
Yeah.
Um,
Yeah.
so I basically was like, if vaginal birth is not happening and you've let me push for a long time or whatever the situation is, then like, let's go C-section because I'm
Mm-hmm.
just not messing around with that. So I was like very open minded. And in my birth plan, I was like pretty realistic. But even so, it doesn't change the fact that I was like extremely disappointed with the outcome or like the situation that occurred.
Mm-hmm.
Yeah.
Totally.
Mhm.
Yeah. So
Oh,
you
and
were, oh, go ahead.
I'm so sorry to
No,
add,
you're
I
great.
forgot to say this. I did have a doula. I had two doulas. So because my birth took so long, one was there and then she was there for several hours and then she actually had to go and then the other one came and took over for her. So to answer that question, I did have doulas as well.
Mm-hmm. And as somebody who has not given birth or been in like a labor and delivery room other than like postpartum, is that normal, or do you normally work with like a doula and they're like help you manage your birth plan? Is that
They
correct? Or
they can. I think that a doula can be as involved as you want them to be because like they're providing a service, you're paying for it, and so they can kind of tell you like this is what we normally do to help you prepare, or and they can ask you certain questions like when you're going through contractions, do you want physical touch, do you
mm-hmm.
want music, do you want us to take pictures, like they have all these things they ask you in advance so that they're prepared while they're with you. And then we met in advance and they talked about what my preferences were for the overall plan and how I was feeling. Yeah, so they're
Mm-hmm.
kind of with you at different stages throughout.
Okay. So you had a birth plan, you had a doula, and you got like a bonus doula because of how
Hmm.
long it took. You were flexible within your plan and very reasonable about like if these risks are presenting, I'd rather go C-section. Like you weren't like it doesn't sound like you were someone who was very attached to like it has to look a certain way.
Hmm. Exactly.
So when did you go into labor?
It's a really hard question to answer. So,
Okay.
um, I'm not exactly sure. I think right after everything that happened, I did some math and I kind of figured it out, but I was sort of like in and out of early, I think it's called early labor. Um, and I probably should have like brushed up on all my terms before doing this because it's
Oh,
been a while since I thought
You're
about it,
you're
but
good. And also, I'll just remind listeners, neither of us are medical professionals. We're just talking
right.
about Taylor's experience. And if I ask something super ignorant, it's because like I don't know much about this topic.
Yeah.
So,
And if you
so
have people like contacting you to correct anything that I've said or you've said about like the names of things or whatever, that's totally fine with me because a lot of this I've also like sort of tried to not think about for a while for good
absolutely.
reason.
Yes, absolutely.
Yeah.
Absolutely.
So anyway, I was in early, I guess I would call it early stages of labor for a very long time, like on and off. I would have contractions, they weren't consistent. They would be like 10 minutes apart and then 3 minutes apart and then 15 minutes apart. And then
Oh.
like it was just it was all over the place. Um, and I had back labor. So if someone's listening and they don't know what that is, then basically when the baby's born, baby is supposed to be facing like imagine like the pregnant woman or the pregnant person I should say is laying down.
Hmm.
Baby's head should be facing like their baby's face should be facing the parent's spine, right?
Okay.
So, but my son was like, we were spine to spine. Like he was turned the other way. So his head was still down. He wasn't breech. Like his head was in the correct down position, but then his face was, he was face up. They call it sunny side up. I think that
Oh,
like the,
little
I,
egg.
yeah, a little egg. I think the term they use, like the medical term is OP and it's like the name of the position. I could actually probably look it up. But anyway, that's you guys know what I'm talking about. So
Yeah.
he was just facing the wrong way. We were spine to spine. So when that happens, and I knew he was because I had so many extra ultrasounds because of my two vessel cord. They made me do all these extra tests. So they
Hmm.
had told me that's how he was facing. And they're like, don't worry. Usually babies just like figure it out by the time it's go time. Like they'll turn themselves.
Hmm.
So I wasn't that worried, but I knew because we were spine to spine and he was sunny side up that I would have back labor. So back labor is different from just regular contractions that you might feel. So regular contractions are not always, but tend to be more consistently timed. So like you might
Hmm.
start having contractions like 10 minutes apart and then 8 minutes, whatever, and it like slowly or quickly, depending on who you are, sort of the time in between contractions gets shorter, and that's how you know it's like things are going to happen.
Yeah.
So for back labor, like you kind of just have contractions all the time and there's not really like breaks in between and you
Ooh.
feel everything in your back. So the way I described it um immediately after I like was reflecting on what was going on, I was like talking to some friends who had asked me what it was like and I was like it was like I was being like stabbed in the lower back
Oh
basically.
my God. Yeah.
And there was not really like breaks for me to like catch my breath, which is like I think a big difference between just like regular contractions, which I'm sure are also horrible. I'm not saying that they're not also painful.
Right, right, right.
I'm sure it's also not an enjoyable experience. But so anyway, the reason I'm
Don't.
saying all that
Mhm.
is just because it was hard for me to tell when I started because I just had these like horrible pains, like back pains on and off for a while. So I would
Mhm.
say that was like a day kind of that I had
Okay.
that. And then I actually ended up meeting virtually with the woman who would become my lactation consultant, who was like probably one of the most helpful people throughout my entire experience.
Mhm.
I was supposed to go to her office to meet her, but because I was having these weird contractions, I had to just meet with her over Zoom. And so I'm like having contractions while talking to her. And that was on May 30th. So wait, was it the 30th? It might have been the 31st. I think that was the 31st,
And how
May
pregnant were you
31st.
at this point? Like week
Um,
wise?
I was about to be 41 weeks. So it was like on that Friday, I would have been 41 weeks, and this was the Wednesday.
Okay. And
Yeah,
what was your original due date?
the 26th. So
Okay.
I was exactly 1 week late
Okay.
in summary.
In my okay, yeah,
Yeah.
in my mind, it because it seemed like you were so pregnant, he was so big, and
Hmm.
then we was like waiting, and so
Hmm.
as your friend, it felt like it was longer than a week. I'm sure. I'm
Yeah.
sure existing with that, it felt even longer for
Yeah.
you.
Every day I'm like, oh, what's going on?
Yeah.
Like, can we move things along here?
And I know you
Yeah.
have and we can cut this out if this is something you don't want to talk about, but you've as long as I've known you, you've had like back issues.
Yeah. Hmm.
Did that contribute to you having back labor, or I'm
I
sure it made it extremely painful regardless?
I don't know if that has anything to do with it. I think
Okay.
another thing that could have to do with back labor is if you normally feel menstrual cramps in your back, then you might have
Mm,
back labor regardless of the position of the baby. But I don't know if that's a guaranteed thing. It's just something I've read. So
yeah.
maybe somebody who has had that experience would know. Like now, when I have cramps, I get them in my back, but I don't think I did before. So I don't,
Mm,
that must have had something to do with the birth. I don't know.
mm-hmm.
It's just kind of a
Mm-hmm.
weird, there's a lot of weird stuff that goes on with your body afterwards and you just don't know. And you're like, all right, it's fine.
Mystery. Yeah. This is
Yeah.
happening now.
So yeah, it's the short version of everything I was saying. I don't really know when it started, but I do know that by Wednesday night, so that was May 31st,
Okay.
um, Corey and I were like sitting on the couch trying to like eat and watch a movie. I couldn't really get comfortable. I was like timing the contractions, but at this point, I was still like comfortable enough to have a conversation. Like I didn't know what
Mm,
I was getting in for. I was like, oh, these feel pretty intense, but I was like still having a conversation. So that's clearly not that bad in
mm,
comparison to like what you will experience when it becomes time to actually go to the hospital.
uh-huh.
So my doulas had given me all this information on when to go to the hospital. So that night they were getting closer and closer together. So around like midnight, we ended up going to the hospital that I was supposed to go to, and they checked me, said I wasn't dilated enough, let me wait there an hour to check again. I wasn't dilated enough. I was only 2 centimeters. So at like 3 a.m., they're like, I'm so sorry. You need to go home. Like, we can't have you here because it's not time yet. And at that point, they were pretty bad. The contractions were pretty bad.
Mm-hmm.
And I couldn't sleep. I couldn't eat. I couldn't do anything. Like, it was constant, like just bad. And they were
Mm-hmm.
like, the doctor, who was a man, let me just, and I, sorry, I said that with a lot of aggression.
Which, by the way, he was a man.
He was a
Man.
man. Nothing wrong with a male doctor, but
No,
I think
right.
when you're talking about like the pain of childbirth and you're a man who's never experienced childbirth, like you don't really know the what that feels like. So
Right.
just that's where the aggression comes from. And he's like, he was like, you can go home and take a Tylenol and take a bath. It probably won't help, but you can try that. And I was like, cool, great,
Thanks,
sounds so
bro.
good. Yeah.
Yeah.
um, the nurse at that hospital was very sweet. She was like, you know what? A lot of people at 2 centimeters are screaming for the drugs and like ready to climb up the wall out of their skin. So you're doing great. And I was like, okay, thanks.
Oh.
So anyway, couldn't sleep at all that night except for like 2 minutes at a time or whatever minutes I could get in between contractions. And Corey called the doula at like 7 a.m. and because he's like, we went to the hospital, they sent us home, we want to go back because it's really bad. And she's like, well, let me hear her. So he like put the phone next to me while I made like guttural animal noises. um, and she was like, okay, that's good, she's breathing, but like, you'll know when it's time, because like she won't be able to even like hold a conversation. And she was like, if she's feeling nauseous, if she thinks she's going to throw up, that's good, that means it's time to go. Like basically they're like, when you feel like you're dying, then go to the hospital. Like,
Oh my gosh.
so this is at like 7 a.m.
Okay.
um I still can't eat, I can't sleep, I can't do anything. I am just on the couch, like trying to breathe through it. And I had followed all these social media accounts that told you like different techniques. And I had
Mm-hmm.
gone to like classes. I had like done all the homework. I had read books. Like I'd done all the stuff, watched videos on
Mm-hmm.
YouTube. Um, and so I thought I would know what to do, but the truth is like you don't really know what to do until you're put in the exact situation, and then you can see like what comes out of you, basically, like what you
Mm-hmm.
can pull out of your toolkit. So
Yeah. Yeah.
um I was trying to breathe through it and etc. But it was just not really doing. I'm like, I I can't sleep when I'm going through this. So I basically just hadn't slept. So we finally go to the hospital at like 3 p.m. I actually had to go to a farther away hospital because my hospital that I'd just gone to the night before was already full.
Oh
Um,
man.
it ended up not being terrible though, because in my opinion, it was a nicer hospital. Um, and the drive could have been a lot worse, but because it was like in a weird middle of the day time, there was no extra traffic. So it took like 15 more minutes, which it could have been like 40 extra
Yeah.
minutes.
Yeah.
So
I'm laughing because in your intro I only said that you live in California, but like now you know she lives in Southern California where it's like we
yeah.
found a window
Hmm.
in traffic.
Yep, exactly. So
Appreciating that. Appreciating that.
yeah. We get there, I'm unable to like even hold a conversation to get myself checked in. They're like, it's fine, we're
Oh
used to that,
man.
like your husband can do that. They check me and the doctor says I can stand. I'm like, thank God. Oh my God. Like such a huge relief at that point.
Totally.
I was like, I cannot go home. Like, you need to keep me here. And I had said in my birth plan that I didn't want to like just immediately get the epidural like as I arrived. And they didn't want to give it to me then anyway, because they were still trying to move the position of my son. So
Oh,
it's easier
yeah.
without the epidural. So I
Mm-hmm.
was fine with that because I was just relieved that I was there. So even though I was like in excruciating pain, I had like a really good attitude. I was like excited, even, through everything. I was like, okay, now I'm good. We're here. This is
Yeah.
great. Don't care that
Yeah.
I'm in pain. It's fine.
Yeah.
Um, so I had some really sweet nurses when I first got there, all good. Then it got to a point. So like I think I got checked in at like 3 or 4
Oh, okay.
PM. And then stuff is happening, they're moving me around. Then I got at 7 o'clock, as a lot of you may know, like they switch the staff, like the nurses and doctors and stuff switch at
Oh,
7 a.m. and
okay.
7 p.m. So at
Okay.
7 p.m., I got a new nurse. She was also really sweet. She was pregnant as well, like not super pregnant, but visibly pregnant. Like we were
Uh-huh.
talking about her pregnancy.
Uh-huh.
And I got to this point where I was like, okay, I need to get up. I need to move around. I'm going to go to the bathroom. I go to the bathroom, and I didn't know at the time, but now I know that I'm pretty sure that's when my water broke. Um,
Oh, okay.
so when I went to the bathroom, and because I was just like in pain, I didn't register anything that was happening. I didn't think anything was unusual. I just thought I was going to the bathroom, like
Yeah. When
nothing
you've
weird.
been in pain like this for so long, sorry to talk
Yeah,
over you, but like at this point you've been feeling this way for you're over 24 hours now,
yeah, something
approaching
like that.
like
And
which
when
is
I
a really
did
long
the
time.
Yeah, for context, when I did the math at whatever point that was, like immediately after, I clocked like 52 hours total. So
Jeez.
for like context. Okay, so I'm in the bathroom.
Okay.
I'm suddenly now like I'm sitting on the toilet because I was just going pee, and then I can't get up because I'm in so much pain. So I'm like screaming, I'm crying. Um,
Oh.
Corey comes in the bathroom, helps me up. I go out into the room, and my sweet nurse, pregnant nurse, is standing there, and she's like looking at me horrified because I'm like probably screaming. And she says, so you didn't want to get an epidural? And I was like, no. I'm like, no, let's get the epidural. Like, because I never said no epidural. I just was like, let's try to fix some stuff before we
Yeah.
get the epidural.
Yeah. You were like, give it a little bit of time.
Yeah.
Yeah. Okay.
So she just looks wide eyed, terrified. She runs out the room. And then, like, 2 minutes later, she's like, okay, I caught the anesthesiologist in between surgeries and she's here. We got to do it now. And I can't even, like, get on the bed because the contractions are so bad. So the anesthesiologist, she was very impatient because she, like I said, was in between surgeries. So she's like, you got to do it now. You got to do it now. And I'm like, I'm trying.
No
So,
pressure. Jeez.
yeah, no pressure. And then, of course, you can't move while they're inserting something into your spine. So
Mm-hmm.
I'm
Mm-hmm.
trying to not move while having contractions, which is a very normal thing during childbirth. If someone has an epidural, that's kind of what they have to do. It's
Right.
unfortunate, but that's how it works unless you want things to go horribly wrong with your spine. So um, I get the epidural. It takes about 10 minutes to work, and then it's amazing. Great. I'm like so stoked. I'm so happy. I can't feel any pain. I was really fortunate that I had still like mobility. Like it was actually the perfect amount of epidural because some people can't feel anything, like their legs, they can't move. And I was kind of scared of that happening, but I could still move. I just couldn't feel any pain. It was amazing. I was so just like, this is great. I can do this now. Like all of it's been worth it. Here we
Mm-hmm.
go. And I was
Mm-hmm.
too excited, even though I was like so sleep deprived, I was too excited to like actually go to sleep, which was probably a huge mistake.
Well, you had been up for a really long time at that point, and
Yeah.
I feel like I've heard other people with their birth stories where it's like rest when you can, preparing for
Mm-hmm.
the big push. So I
Right.
can see why you were feeling that way.
And I was just so stoked to get to that point. Like I was
Right.
like, let's go. So I tried to rest. I tried to sleep. I don't know if I ever actually fully fell asleep. I think I was sort of like half in and half out of consciousness for a little bit. But once I got that epidural, things just escalated really quickly in like a good way. Because they were thinking like, oh, around 3 a.m. you'll probably be ready to push. But around like midnight, I was like, something's happening. Let's go. Like, I'm so stoked. I was literally like just
Yeah.
on a mountaintop. Like I was so happy.
Oh.
um, so she's like, okay. I had this nurse who she was very like aggressive, not in a bad way, but more of like, let's go, let's do this. Like you gotta do this, like like an intense coach kind of.
Yeah, yeah.
And she was like, we're gonna do some practice pushes, and she was coaching me on what to do. And then she's like, okay, I'm gonna get the doctor in here and show her what you can do. So then the doctor came in, and I got all like, I don't know what happened. I got like nervous or something. I was just distracted. And so the doctor like sees me trying to push, and the nurse like is whispering in my ear, and she's like, what happened? We just practiced that. Like do it like we practiced. Like it was like, I'm like, okay, lady, I don't know what I'm doing, like I'm just trying my best here. So that was where
Yeah.
like the intensity started being like a little bit much.
Yeah.
Um, and so I eventually got to pushing. We tried a bunch of positions. He was actually still in the wrong position despite like all the stuff that we tried. He kind of turned and then he went back. Um, and then it came to a point where I was like, how long has it been? Because in my mind, I thought it had been like 30 minutes. Like, I didn't think it had been that long because I'm just in my own world. And she's like,
Yeah.
oh, it's been 3 hours. And I was like, oh,
Oh.
I thought it like, I did not register that at all.
Oh my
So
God.
at that point, she's like, okay, the doctor who's on duty on call right now is a C-section fiend. If you don't want to get a C-section, like, you got to get it together. So then I'm
Oh
feeling
man, no
like,
pressure.
I know. And that's where I started feeling like this is my fault or something because
Oh.
I'm not like doing what I'm supposed to be doing. I'm like, I don't know if I'm doing this right. Like, I've never done this before. I'm just doing whatever you're telling me to do.
Mm-hmm.
Um, and so that's where I started to feel kind of pressure to perform better, I guess. I don't know how else to say it.
Yeah.
Um,
Yeah, it
which
sounds
is,
like the messaging was like you're not doing this well enough. You should be doing
mhm,
better. Meanwhile, you're like in a pain cave, not
right,
realizing how much time's gone by.
right. Yeah. So then
Oof.
time continues to pass. I get it again. Doctors and nurses switch again. So, because it's 7 a.m. and I get a new doctor, and she comes in. And at that point, I don't remember how long it's been. It's like at least four, maybe. I think, oh, she came in at 4. I'd been pushing for 4 hours. And she's like, okay, it's been 4 hours. Like, we're kind of at this point where we need to do something else. We need to try something
Uh-huh.
else. And I was like, no, I don't want to. I don't want to do that. I was like, unless you're giving me a C-section, we're not trying something else.
Yeah. Yeah.
And she's like, okay, I'll let you keep trying for an hour. We'll see how it goes. Like she backed off. She was like, you do you. It's fine. And I was like, okay. So she gave me one more hour. And at that point, I just kind of, I was so tired. I was like falling asleep. Like I was in and out of consciousness basically. So I kind of like
Mm,
started to know it wasn't going to happen. I was
mm-hmm.
so hungry. I hadn't eaten like or slept. So even though I was going through this, I was like so hungry. All I could think about was
Yeah.
like how tired and hungry I was. Um, so then she comes in an hour later and I'm like, what are we going to do? And she's like, we just need to get the baby out. And I was like, okay. And she gave me the options and she didn't offer forceps. A lot of doctors won't do it.
Mm-hmm.
Some doctors are really skilled in that and they will offer it, but she didn't offer. She's like, I don't do forceps, but I can offer vacuum. And she was like, to be honest, don't know if that's going to work because of the size of the baby. It could turn into an
Mm-hmm.
even worse situation. I was like, I agree. I don't want to do that. So we kind of just like got stuck on this is happening now. We're going into surgery. She let me think about it some more. My doulas had to switch, and the new doula that came kind of helped us make the decision because I was like, I don't want to go through this procedure. I don't want to go through this recovery. That sucks. That's
Mm-hmm.
not what I was planning. We've come so far, and like I'm not going to make it to the
Mm-hmm.
finish line. And
Mm.
she's like talking to me. She's like, this could be a really good choice for a lot of people. Like she was very like calming and positive about it. And then I had another nurse who also was like, I loved my C-section. It was great, blah, blah, blah. So I was like, okay, it's fine. Let's just do it.
Mm-hmm.
Um, so they actually prepped everything very quickly. I went in. Um, the the anesthesiologist who had me for like my now for the surgery for the spinal block, it was a different anesthesiologist. It was a guy,
Mm-hmm.
and he was great. Um, he was like, I'm gonna walk you through everything they're doing because everyone else in the OR, which there was like 20 people or something.
Mm-hmm.
Um, and to add, I forgot to add this, but sorry, there's so many details. But um, I had, when my water broke, they noticed that there was meconium in the waters, which is when the baby poops in the womb, and they
Mm.
have a risk of aspirating that, which is really dangerous.
Oh.
So once they found that out, that's where they were like, okay, we're going to have like a NICU team in here to help, like just all the precautions just in case, because that
Yeah.
could be a bad situation.
Okay.
So that's why the OR was so full of people because it was like the normal staff plus all these extra people. So it was just like crazy. Um, and the anesthesiologist was very helpful describing to me what was happening. I was like talking to him, I don't remember his name. But I was like, I'm so tired, I might fall asleep while this is happening. And he's like, it's okay, I'll wake you up when something important's happening. You can nap if you want. So that was great.
Mm-hmm.
And um, Corey's in the room with us, obviously. So when my son was born, I they lowered the sheet for a very short second. Just I all I remember seeing his like head and shoulders, and it was back up, and
Mm.
then they rushed him off to like the heater lamp table where they're doing all these
Mm-hmm.
things, and um, people are tending to him. This during this part, I'm kind of I mean, it's unfortunate that I was like going in and out of consciousness because I was tired, but at the same time, it was also maybe helpful because I didn't understand how much time was passing and I didn't understand what was
Mm-hmm.
going on. If I
Mm-hmm.
had been like fully aware, it would have been a lot scarier, I think, because it was scary for my husband who was not going through like the physical stuff I was going through. And
Yeah.
even though he was like sleep deprived, he um, was obviously more aware and he didn't really understand what was going on. So that was scary for him.
Yeah.
Um, but basically, when babies are born, they're given something called an APGAR score, and it
Mm.
measures like they look at all these things, to see if the baby's breathing, what color is their skin, etc. So it's a scale from 1 to technically 9. Like there's no such thing as a 10 APGAR score, as far as I know, because I don't know what the reason is, but basically 9 is like the best you can get
Mm. Mm-hmm.
upon like first being born. Um, but if the baby's APGAR score is 3 or under, it's like life threatening, bad situation. We got to make sure they're breathing, kind of thing. So his APGAR score when he was born was a 3. And
Oof.
then, so they do that test immediately when the baby's born, and then after like 3 minutes and 5 minutes and 10 minutes, like they do it a bunch. So for the first like 5 minutes or so, he was not doing well. And then by the 10-minute mark, he was like where he needed to be, like a 9. So he was
Okay.
good, um, healthy. But I didn't know all this was going on. I just was like in and out of consciousness. And then they finally bring him to me. Um, I had no idea how much time passed. I just was like, he's not with me. And then by the time he comes to me, he's in a blanket, hat. Like, I'm like, I've never even like seen you before. Who are you? Now you're fully
No.
dressed. It's just weird.
And
Because like you think of having a baby and the baby's given to you and just the way they are,
okay, that was the question I was gonna ask for people
Yeah.
like me who have not been in that situation. Like it's usually like baby isn't cleaned up at all. It's just like on
No.
mom's chest, right? Like
Yeah.
unless it's a situation like yours where it's like medical necessity we need to get. And that's for
Mm-hmm.
both mom and baby to have that
Right.
first interaction.
Yeah.
I
So
like how
I
you're
think,
like, I don't know who excuse me, sir, who are you?
who are you? I'm like, I've never seen you before. You're wearing a hat.
Yeah,
Nice outfit.
nice outfit.
So
Oh,
they give them to me, and um I didn't find out until later how much time had passed when I like looked at my medical records, and I found out it was about like 35 or 40 minutes, or somewhere
mm-hmm.
between 30 and 40 minutes. I don't remember. So it was a long time. Um
Were you
and
registering anxiety? I know you were in and out. I know you'd been in so much trauma and probably even like accessing your memory around it. It's probably
mhm.
hazy, but were you like, wait, where is he? Or were you
Kind of,
just
yeah.
okay?
Yeah, again, if I had been more cognizant in that moment, I'm sure it would have been a lot worse. But because I was
Yeah.
just
Okay.
so out of it, like at that point, so many drugs in my system, I was so tired, I just didn't know what was going on. Um, it made me like relatively calm and not register like the panic, I guess.
Yeah. Yeah.
Um, and like a lot of this stuff didn't register to me as traumatic until afterwards when I had
Mm-hmm.
like time away from it. And then I was like, whoa, whoa,
Yeah.
that was crazy. Um,
I feel like
and I
that's
think,
normal with trauma. Not to talk over you, but just
yeah,
to say, like, I think that birth trauma or other trauma, sometimes it's like our brain lets us get some space from it and then to be like,
mm-hmm,
oh my God, what just happened? That was so scary. So that
mm-hmm,
from what I know about trauma, that makes sense to me that you're not maybe like immediately sensing how traumatic it was until you had some space.
right,
Yeah.
exactly. And then I guess when they brought us back to like our normal room, he had like low oxygen, so they kept like putting him on me and then taking him away and putting him on me and taking him away. And I'm still so out of it. I have no idea what's going on. I'm just like,
Yeah.
okay, do your thing. Like,
Yeah.
I'm grateful for my like tired brain for protecting me from the trauma of that situation even
Yeah.
further.
Yeah.
Um, so yeah, it was a very, in the moment, I didn't think it was like so horrible, if that makes sense.
Mm-hmm.
And then later, when I processed everything, I was like, wow, that was a lot.
Mm-hmm. Mm-hmm.
And I think the worst part of it for me was I felt like I had just completely failed and I
Mm.
hadn't done what I needed to do and I couldn't do it. And because I had like consumed so much material about like how I could do it and then I just like couldn't. So it
Right.
was like I was angry with myself in the situation as
Yeah.
well.
When and like what you described, your first exposure to this idea of like, my body's made for this, I can do it. That's not just like something you learned in the 9 months that you were pregnant with your son. You learned that like 10, 15 years prior.
Mm-hmm.
So this is something that you've held as a belief for a really long time. So of course, I guess just say like, of course you felt that way. I'm sorry you felt
Mm-hmm.
that way, but that's what you thought. That's what you'd been
Yeah.
educated. Like you learned that in a college class.
Mm-hmm.
Yeah.
Yeah, it was so deeply ingrained in my
Mm-hmm.
mind. Um, and I also had, even though I thought like, oh, I'm okay with getting a C-section if I need one, I still like society teaches us like negative things about it, like whether we're aware or not. Like I thought about afterwards, like, why am I feeling guilty? Why do I feel like I gave up? Why do I feel like I took the easy way out or whatever? And it's because like there's this weird perception in society that like a cesarean birth is somehow easier because you don't
Mm,
have to do certain things in order for the birth to occur. But that's
mm,
like, of course, not at all true. And I didn't know I had that perception until I like experienced that. And then I would see like horrible toxic comments online on some of the accounts that I would follow that like made me realize like, oh, I've been weirdly subconsciously taught to believe that a C-section is not as legitimate as a
mm,
vaginal birth.
mm-hmm,
Um, of course, I don't actually believe that. That's
mm-hmm,
ridiculous, but that's what I had sort of been taught without me realizing.
mm-hmm, mm-hmm. Yeah, I feel like there's a lot of rhetoric, and again, not a medical expert, but where it's like it's better for the baby if you don't go
Mm-hmm.
C-section.
Yeah.
And it's like I'm gonna use the term cop out, even though we know like none of what I'm saying is like substantiated. It's not.
Mm-hmm.
Because I mean, if we play the tape through and go, okay, well, what would if in your situation, like if you wouldn't have had that, I mean, we lose you and we lose baby,
Mm-hmm.
or like not even 100 years ago, it's a choice between your life or his. Like that's what it
Yeah.
comes down to. So I feel like we should celebrate that our modern medical landscape is such that people can have C-sections, and that's great.
Mm-hmm. Yeah, and you were the one who actually pointed that out to me when we were talking a long time ago when I was telling you like my experience, and you said, "Well, like we're so lucky that we live in a time where we can actually take care of mothers because the alternative is that you die." Like
Oh,
that's what would have could have happened, which did happen, continued to happen until like not that long ago, and it still
yeah.
happens.
We
So,
the death rates at the top of the show. I mean, it's pretty,
yeah.
and I'm so glad that didn't happen to you. And I also hope when I said that before, I hope I wasn't in that group of people that was at all dismissing your experience.
No, no, no. It
I'm
was
just
like
so glad that you.
it was helpful to have that perspective because I
Okay.
felt like my brain immediately after everything happened was telling me that I wasn't good enough and that I failed and like why couldn't I do it? And then you pointing out like, well, there's lots of people who quote unquote couldn't do it. Not that
Mm-hmm.
that's like what you meant, but like they would just die and like you don't have to
Right.
die because we have
Yeah.
modern medicine.
Mm-hmm.
And you were pointing out like how many people when we didn't have access to these things would just like not make it through and they had no other choice. Like they didn't get to make a choice. Like I got to make a choice, you
Mm-hmm.
know? And even though it wasn't like the choice I wanted, like I still had the opportunity to make that choice
Mm-hmm. Yeah.
and be okay at the end of
Mm-hmm.
it.
Mm-hmm. So I want to make sure we like finish like the birth story with you going
Yeah.
home, but I also
Mm-hmm.
just want to check in on the that feeling of I failed. Like were you registering that? Like is that something that you were able to articulate or even say to medical staff?
I expressed it to my not immediately after. So this is
Okay.
like days or
Okay.
weeks after, but
Yeah.
like to my lactation consultant and my doctor, the doctor who delivered him, and my doula and my nurse practitioner. So I like told multiple people, but like well after.
Mhm.
The first person that I talked to about it was my lactation consultant, who I saw like the day after I got home from the
Mhm.
hospital, and she was like the most helpful
Oh,
person
good.
because she's just like really sweet, and that's like her demeanor is to be warm and helpful. I mean, that's what makes her good at her job, but also
Mhm.
um, because she was like the first person like on the ground when I got home who I had
Mhm.
an appointment with. That was really helpful.
Mhm.
Um,
What did she say
and
to you?
she was just like very understanding. She's like, I understand why you feel that way. Like just validating, not
Yeah.
trying to be. And I do want to say this, and I don't know if this is the right spot to say it, but because it's coming up organically, I'm just going to say it.
Please, yeah, please.
One of the most harmful things that people say, and they don't mean it to be harmful, they mean it to be helpful, but it's actually like the worst thing that you can possibly say to someone who's experienced birth control, birth, I'm sorry, birth trauma. I almost said birth control. Oh my gosh. So the one of the worst things that you can say is, well, at least you're healthy, at least baby's healthy,
Oh,
because it kind of negates everything that you just experienced. And it's like kind of like, well, you should be grateful because at least nothing bad and at least nothing else bad happened. So it kind of makes you feel guilty, like, oh, I
yeah.
shouldn't feel this way because at least I'm alive. So like um she was validating what I was saying, and she wasn't saying like, well, at least blah blah blah. I've
Mm-hmm.
been seeing more about that lately. One of the helpful Instagram accounts that I follow, because there are helpful ones that were not negative to my experience.
Yeah.
Um, gosh, her name is, I'm probably gonna, well, I know her name is Tina, but I'm forgetting the actual Instagram handle name. So I can
Okay.
share the resources of like the accounts that are
Yeah.
actually helpful afterwards if you want to put that in like the notes
Yeah,
or
that would be
something.
great. Yeah, we can put that in show notes for sure.
Yeah. But Tina recently posted about how the standard of care should be so much higher than at least, like those words, at least, like, oh, at
Mm-hmm.
least you're alive. Like it should be so much higher. It should be like, I'm glad you're alive. I'm glad baby's alive. Let's talk about how you're feeling. I'm sorry that happened to you. Let's make it a better experience. Like the conversation needs to be just so different than
Mm-hmm.
at least, because that's like not acceptable.
I'm really glad that you said that because I hope that if people listen to, even if it's just like one episode of Uniquely Qualified, they hear, don't use phrases like at least or say
Mm-hmm.
anything that in any way invalidates or detracts from somebody's pain,
Right.
because this actually came up on the miscarriage episode too, where it's like, well, at least people could have said, well, at least you have a healthy baby at home, at least you're okay. It's like, don't say that, there is not a context where that is actually helpful to somebody. So
Right.
I'm really
Right.
glad that you brought that up. Let's take
I'm
a
so
little
sorry. I have
let's
to.
take a
Yeah.
break. Yeah, no, you're good. Let's take a quick break. We'll be right back.
Okay.
We are back from our break, and before we get back into the story of Taylor's birth of her son, we just wanted to quickly acknowledge that if you're hearing us approach or broach this topic with levity, or if we're like making jokes, that's just kind of the nature of our friendship. And so we 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 both have a bit of a penchant for Schadenfreude and like laughing at dark things, but we both very much acknowledge the gravity of having a traumatic birth. And obviously Taylor lived through it. But we just wanted to make sure that we had that like self-awareness check-in with listeners of
Mm-hmm.
like, we understand that not everybody might be ready to laugh about something like this or think it's funny. It's
Yeah.
just we've just always had a very goofy friendship also.
And actually, I wanted to bring this up, and I just thought of it now. I'm sorry we didn't talk about this like
Oh no, it's all good.
beforehand, but I do want to sort of say that I wasn't always able to talk about this with sort of this lightheartedness and like make jokes about it and stuff, because obviously if you're someone who's been through any level of trauma, no matter what it is, no matter what caused it, it's like you go through these phases where you can or can't talk about it, and in what way you talk about it, etc., like what you're comfortable with.
Mm-hmm.
um so I feel like at first I wanted to overshare everything with
Mm,
everyone, and then I would sort of start to see their reactions to my oversharing as like,
mm.
oh wow, oh. And then
Yeah.
it made me feel very like alone, because
Mm,
I thought maybe my brain thought by oversharing that I would just like overshare and then somebody would be like, oh, me too, and I'd be like, oh
mm,
cool, let's be friends. So
mm-hmm.
like in the context of talking about like going to mom groups or something like that.
Yeah.
um but so I went through that phase, and then I went through this phase where I just didn't want to talk about it at all because it would make me upset. And
Mm-hmm.
now I'm kind of at this phase where I'm down to talk about it, and I'm more comfortable with talking about it. So that's where like the comedy is sort of inserted to like make it more of a, like, I don't want this to be like a doomsday story if someone's listening and they haven't personally experienced the birth process and maybe they want
Mm-hmm.
to experience having children one day. I don't want it to be like a doom is gloom, like this was horrible. A lot of
Mm-hmm.
the experience I had was positive. Um, and then, of course, a lot of it was not positive. So I just wanted to share that piece, I guess.
Yeah, no, I'm really glad that you brought that up because I guess I'll just share like as a bystander, and Tay and I live in different states, so a lot of this is being communicated over the phone or different mediums that we use, but I I feel like I got the message, he's here, we're okay, like birth stats. But then I really think that you were like, I'm not fully ready to talk about what has happened. And then you were like, I'm going to write something out. And then the day came where you and I didn't think there was anything wrong with this, to be clear, but like where it was clear that you had like copy and pasted, like, I'm not fully ready to talk about this, but like just so you know, and it was like the story
Oh,
from your point
yeah.
of view.
I
But
kind of remember that now.
you were
Yeah.
maybe like 4 weeks postpartum, maybe not even that, but where I just remember I
Hmm.
was like, okay, there's, to me, the first flag of there's been some trauma here was that you were like, I'm not ready. And then when you did, it was very like prescriptive, and you're like, this is what I am ready to talk about. And also just to validate, like, overshare is totally related to trauma. Like a lot of people who have experienced any different kinds of trauma will find it like that'll just come up. It'll just like come out.
Hmm.
So I'm glad that we're just like kind of processing and talking about that, because
Hmm.
I'm somebody who, like, if I find myself in a situation where I'm like, oh shit, I overshared, then I get embarrassed. But like
Yeah.
in a situation like this, especially, it's like, oh, it's a trauma response, and you went through
Yeah.
something very traumatic, so like that's okay,
Yeah.
you
And I
know.
want to add on to that too. It's like, I know a lot of people who are listening to this are listening for the distinct purpose that they also experience birth trauma. So they want
Mm-hmm.
to hear another experience and maybe find some common ground and some community and understanding. And I just want to say, like, I feel this huge responsibility in telling the story because I know people who have had far more severe birth trauma than I had, who had near death experiences of either
Mm-hmm.
themselves and or their child. I know people who have had birth trauma that was maybe not as severe, but it still, but their experience still induced trauma. So like, I don't want my story to dictate what is or is not traumatic, because I think one of
Mm,
the other things for me that was like hard to process was like, do I have the right to be traumatized by this? Like, I had that thought where
yes.
I
Yeah.
was like, well, people say at least I'm healthy and at least my baby's healthy. So like, do I even have like the space to say that that was like a not so positive experience if like everything
Mm-hmm.
is like technically fine?
Mm-hmm.
So again, just circling back to like, it's not cool to say to somebody about any sort of experience, like, well, at least this, like,
Mm-hmm.
it could, like you were saying, it could be applied to like not just birth trauma, but like pretty
Mm-hmm.
much any traumatic experience. So
Yeah.
like, you can't compare what you went through to what someone else went through because everyone experiences their own feelings and their own fears and their own, like, everything is different depending on the person and the situation, basically.
Yes. Yes. And I'm again really glad that you brought that up. The Because the first guest of the podcast, my friend Andrea, she is a therapist at a trauma clinic. And I think she
Mm-hmm.
said on, like, when she was on her episode, that everybody defines their own trauma. And so she works with that with patients that are literally there to process trauma. And somebody might have had like the same type of violent experience, but they're experiencing the trauma on varying levels. And that's
Mm-hmm.
just part of being human. So I appreciate you acknowledging that, in specifically like in the context of birth trauma, of like, there's going to be different levels of this trauma being internalized, processed,
Mm-hmm.
and healed from. Um, and I'm glad that
Yeah.
you're in a place where like we can say things and like make an awkward
Yeah.
joke, because it was not always like that.
Mm-hmm. Yep.
Yeah. Yeah. And for the people out there that are still in that place, that is okay. If
Oh
we were
yeah.
having this conversation even a year ago, Tay, I bet that there would be maybe some tears shed.
Oh, for sure.
Yeah.
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 Yeah. A year ago, I was still very much not well. So it'd be
Yeah.
different
It
depending on where you
takes
are in your
time.
timeline.
It just takes
Mm-hmm.
time. Healing takes time, and that's okay.
Mm-hmm.
hmm Is there anything you want to say more about that, or can I guide us back towards the more like timeline specific
We can go
discussion?
back to timeline.
Okay. So
Yeah.
I think the last we were talking about the story of birthing your son, he was being taken away from you because of changes in his oxygen saturation.
Mm-hmm.
So how long did that go on? And is that still something that you deal with him? Or just
Um, so that wasn't, I don't know, I had no concept of time, but I did look at like timestamps on the photos that were taken on my phone. So I was able to figure out some stuff. That must have been going on for 30 minutes to an hour or something when we were in
mm-hmm,
there. And then the reason I know that is because there came a point, and I'm still so exhausted, I'm in and out of consciousness, like while he's breastfeeding, while they're adjusting him, all these
mm-hmm.
things. There came a point where I like looked to Corey and I asked if he wanted to hold him, and he's like, "Yeah, I haven't held him yet." And then it hit me. I'm like, "What?
Oh.
You haven't held him yet?" Like I like literally didn't even register that because I was like so out of it. And I'm like, "What? How? What?"
Oh.
um, I just in my brain I probably thought that he had because he like cut the cord and went over there and met him before I met him. So I just for some reason thought like that had already occurred. So then I felt awful, of course, and I'm like, you need to hold him like right now.
Yeah. Yeah.
So I took a picture from laying in the bed, like of him holding my son. So
Hmm.
then
Because he
that
was
kind of
so
gave me a
excited to be a
timestamp.
dad too. Sorry.
Oh, so excited. Yeah.
Such a
Um,
happy dad.
so yeah, after that, we were moved to so after you're done with labor and delivery, they move you to a separate room, which a lot of people may already know that. But I think I did know that, but it's still in the moment. I was like, where are we going? Like, what are
Yeah.
we
Yeah.
doing? This is my room. Why
Yeah.
do I have to move? Oh,
Yeah.
the other thing that was crazy that like any person who's been pregnant before and has given birth before will tell you, like after baby is born, regardless of what type of delivery you had, they have to do what's called a fundal massage on your stomach, like multiple times within the first like 24 hours or something, where they
Oh.
basically push on your stomach. And it's to check, I think there's many purposes to it, but I think the main reason is to check that you're not like bleeding too much because like hemorrhaging can happen.
Uh-huh.
So they're doing that to me multiple times, obviously within the first 24 hours. And I remembered learning about it in my months of research leading up to this point. Like I knew that was a thing, but I didn't
Mm-hmm.
register in the moment like why they were doing that because I was so tired. And I'm like, why do you keep torturing me? Like, leave me alone. They're just, and they don't really explain. They just kind of come in and do it because it's the nurses who have like, probably 50 patients and they just need to like make sure you're okay and then go on to the next room. So it's like they come in and they're just like pushing on your stomach and like, I'm like, I just had surgery. Like, what is happening?
So I didn't know that that happened to cesarean birth
Yeah,
moms too.
everybody.
Okay, everybody gets that
Yeah,
little flavor of torture, huh?
yeah. It's
Okay.
really uncomfortable.
Yeah, that
Yeah,
sounds very, from what I've heard from other people's experiences, that some people are like, it's like as painful, if not more painful than parts of labor. I don't know that.
yeah. It's just, I wouldn't say it was like the worst thing ever, but it definitely wasn't very appreciated in the moment.
Yeah, yeah,
um,
for
so
sure.
that's just kind of added on to the experience of like WTF is happening right now. Like,
Right, right, right.
why you just not having an understanding and just being so out of it. And so we went to the postpartum room. At that point, I think actually I was like very happy within the first like 24 hours. I was like, he's here, we're good. At that
Oh,
point, at that point, things were good. And then I think something hit me like maybe the next day where I just like started to get really emotional. And I'm like, what just happened? Like, where it's
Mm-hmm.
like you come out of the fog and you are processing. Um,
Mm-hmm.
and like we haven't even touched on this yet, and I'm sure that you're gonna direct the conversation there at some point, but like it's very common. I know like people hear about postpartum depression and postpartum anxiety, and that's like a topic of discussion for sure in the medical community and like the mental health community. But like one thing I didn't realize, even though my friend tried to warn me about it, um, I just didn't really know what it was referring to until it happened to me. But like baby blues are very much a thing. So it's less severe than postpartum depression because it's not like a long-term thing. It's more of like a couple of weeks. And like
Mm-hmm.
something, and you can correct me afterwards if you know this or if you look it up, but something like 75 to 80% of people who give birth experience the baby blues.
Mm,
And it's
okay.
so it's like a shorter version of postpartum depression. It's basically like you can't control your fluctuation of emotions, you're crying for no reason, you have brain fog. Like it was just so intense for me. Like the
Mm-hmm.
first 3 weeks were so intense for me that I, even though I was warned by other friends like that could happen, it was just very disorienting.
Mm-hmm.
So I think that was happening, plus like obviously I didn't have the birth experience that I was expecting, so I was like trying to figure that out, and I was endlessly Googling things that I could have done differently, or
Oh,
you know what
yeah.
I mean? Like, you're like,
Yeah.
what did I do wrong? Why did this happen? Even though that's pointless. It's a fruitless
Mm-hmm.
search.
Mm-hmm.
Um,
Mm-hmm.
but just, yeah, the first few weeks, even if you have a delightful birth, even if like everything's good, it's still really hard. And it
Mm-hmm.
doesn't matter what warnings people give you, like, you don't know until
Mm-hmm.
you're experiencing it.
Mm-hmm. Yeah, I feel like this is just totally anecdotal based on my friends and people that I know that that recent postpartum where it's like buckle up, it is a roller coaster and your
Mm-hmm.
hormones are over the place. And I have one friend who's like, and I just would start randomly sweating where it's like, excuse me, what's going
Yes.
on?
I
Like
didn't know that was a thing either. And then when it happened, I was like what?
like, excuse me, what is happening right now? Where yeah, we're just generally like unaware of
Mm-hmm.
like what it's going to like feel like in our bodies after our
Mm-hmm.
bodies give birth.
And there is some crazy statistic, and I keep throwing out these stats that I knew at one point, and I'm so sorry if I'm getting them wrong. So
It's a
like you can fact check me, like we're
we'll
in a
double
debate.
check
Like
if there's anything, if you're
yeah,
saying anything incorrect, I'll put it in show notes. That's what I've been doing.
cool. Great.
So don't worry. We'll make sure that we get the right information out there.
But anyway, there's this crazy stat that I learned in one of the classes that I took where it was like the amount of hormonal change that your body goes through in the first 12 weeks postpartum is equivalent to all of puberty. So like
What?
yeah. So that's why you're like crying and sweating and like having all these weird things happen because you're just a mess.
That makes me anxious. I think I just started getting
Yeah.
anxiety sweat thinking about that.
No, for real. It's really wild.
That is really wild.
So, if you're listening to this and you know somebody who recently had a child or is going to soon, just give them lots of extra grace, I should
Yeah,
say,
totally.
because it's
Yeah.
wild.
Mm-hmm. So let's let's talk about discharge from the hospital.
Hmm.
How long did you stay there? And how long
So
was your son being monitored?
he was born on a Friday morning. So that means I got there Thursday night. And then I was slated to leave on Monday morning. That's like the other weird thing. It's like once you get through everything, you're kind of like, wait, how long am I here? Like, what's the plan? um, so they had said like tentatively Monday, but that weekend they were just so busy. Like, I told you the hospital I was supposed to go to was full, and then they sent me there, and
Mm-hmm.
that hospital like basically filled up after I had already been admitted. So like good thing we got there when we did. It was just a busy weekend, I guess.
Mm-hmm.
So because they were so busy, they're like, you can leave Sunday if you want. instead of Monday. And um I was kind of wanting to stay until Monday just because I was like scared to like transition home because I was like, what are we doing? Like,
Yeah.
what is this? Even though obviously be more comfortable at home because you're in your own space and there's not like nurses coming in all the time.
Hmm.
Um, but we ended up going home on Sunday night, and that was just the best way I can describe it. Just so weird. Like, yes, happy because you're like, oh, I'm bringing my child home. Like, this is a beautiful moment, but also so weird. Like, just to
Hmm.
be honest, because you're like going from you had this life before you had a child where it was like you and your partner or whoever lives with you, or if you live alone, same thing. Like you were used to a certain life, right? And like what
Hmm.
home life looks like. And then all of a sudden it's just like everything's the opposite. Everything's so different. I just
Mm.
remember like having this breakdown moment where I was like, everything is so weird.
Yeah. Yeah.
um, because you know you're not sleeping normal hours either, so it's like everything that you would normally do is not what you're doing right now in that
Yeah.
time. So it's just very disorienting.
Yeah. I,
Yeah.
I feel like anybody who's been around people with babies, even in their first year of life, like I'll speak for myself. It's like you become untethered from time and
Mm-hmm.
you're like, wait, how long has it been since they started napping? I don't know. And I'm just here visiting. You know what I mean? Like
Right.
you just become it's just like babies change like the concept of time. And it's
Mm-hmm.
just so I don't know. I don't know anything else in life that just makes things feel so different than when you bring a
Right.
new life into it.
Totally.
And you were pretty impacted in terms of you weren't super mobile for that first week postpartum, right? Like you
Mm-hmm.
needed a lot of help.
Yeah, I couldn't like I knew once I decided to go through with having surgery, I was like, oh, the I'm dreading the recovery. Um, I do think, and again, everyone's different, so I don't want to speak for the general public, but from what I understand, a typical planned C-section that's not an emergency, that doesn't have complications, um, they give you a timeline, and within that timeline, I think it's something like, after the first 2 weeks, you should be feeling like okay, like you could go on walk, like short walks and stuff, like even though it's a major surgery, a lot of people have described feeling somewhat normal after like let's say 2 weeks.
Okay.
Of course, there's like a lot more to that. Like you're not going to be doing physical activity, but like
Mm-hmm.
you're not in like excruciating pain, for example.
Okay. Okay.
Um, but because I had like gone through so much, and part of the delivery for his C-section was they had to like use a Foley balloon to like push him back up, to like
Oh.
correctly get him out safely. And because I would push for a long time, like I still sort of had like some recovery from all of that,
Mm-hmm.
and just being so tired, and like, so I feel like my recovery seemed more intense than maybe it would have if I had just had sort of like a standard, if there's such thing as like a standard cesarean.
Mm-hmm.
So like I fortunately my friend who was an angel like sent me stuff that she had used during her recovery that was like so helpful to me. I don't know what I would have done without her help. Um like for example, this one pillow that allowed me to like sit up in bed because I couldn't sit up. I couldn't turn over in bed. I couldn't stand up out of bed. So Corey had to like help me do all of that. Like in the middle of the night, if I wanted to turn over, he had to like come turn me over. But that I would say that phase where I like couldn't do anything by myself was like maybe, I don't know, 3 days. And then on like the fourth day or fifth day, I was like, oh, I can stand up now as long as I have like something next to the bed I can hold on to. So we put like a chair there.
Mm.
Um, but one thing I remember being really hard for me mentally was like I had never changed my son's diaper because I couldn't do that. And so like Corey had to do it every single time, and I just was like, I can't even do that. Like I can't even like take care of him. Like I truly don't know what
Yeah.
people who don't have any help. Like if you're a single parent, you come home if you've had a C-section. Like I don't know you would do. Like you would have to have help, I assume, in some way.
Oh my gosh. Yeah.
Like it's incredible.
Just one of those things where like I know you and I are both like single moms. How do you do it? So
Right.
incredible. But I love to beat the drum of like we're made for community. We're like pack animals. We're meant to
Hmm.
help one another out. So in situations like that, it's like, yeah, we need one another.
Right. Yeah, you
Mhm.
totally need some form of community.
Mhm. But then day 4, you were eventually able to change diapers and be a little more mobile.
Yeah, I could like go from, the bed to the bathroom to the couch to the kitchen. Like I think at 1 week we had some family over and I was able to like sit in the kitchen at the island and eat and just be mellow.
Mhm.
So that was good. So
Mhm.
in some ways I feel like it was worse than I thought it would be. In other ways it was like so much better.
Mm.
But I guess maybe I just didn't know what to expect because I hadn't had a major surgery before.
That's a good point. I wonder what the statistic would be around the number of people who have C-sections that's their first surgery.
Yeah. I mean, I had a surgery as a small child, but like when you're a kid, you bounce back so fast.
Yeah.
Like I don't even remember. I remember like I was being forced to stay in bed for a couple days, but like not because I was in pain or anything. It's just like I had to like doctor's orders,
Yeah.
and then I like went back to school after I think 3 days. So
Mhm.
that's a totally different experience.
Yeah. Yeah, good point. So, one of the things that you've mentioned that we've talked about is how there was this like kind of a slow roll into the realization of like, oh, this was a traumatic experience. Looking back, are you able to identify when you registered, oh, I've had a traumatic birth?
um, that's a really good question. I remember there was a point in the hospital where I like looked at my son and like just started crying because I was like, oh my gosh, he's here. Like the reality of the
Mm-hmm.
situation hit me. Where like a lot of people, I think that might happen when they're like actually born and put on your chest. But because I didn't
Okay.
have that moment, it happened like a day later.
Mm-hmm.
Um, and maybe that's when I realized like, hey, it's not fair that I'm having this moment a day later.
Mm-hmm.
And some people don't have that moment for a month or whatever, like because there's so many circumstances. They might have a child who's in the NICU, or they might
Mm-hmm.
have a medical emergency and they're like I know people who were not able to meet their child for several days because of their health and like
Mm-hmm.
their emergency situation. So um like again acknowledging that people go through these things that are so intense, and like my story of like what happened is just like one tiny little glimpse into like one reality.
Mm-hmm. Mm-hmm.
And then yeah, like I thought like, oh, it's not fair that I'm having this moment like a day later instead of like when he was born. And then like after sort of processing more and thinking about friends that I do know who did have to wait days or
Mm-hmm.
whatever their situation was, and I'm like, oh my god, like I knew that that was bad at the time. I knew that that would have been a hard experience, but like I didn't realize like how intense that was until I had an experience.
Mm-hmm. Yeah, I feel like this is one of those things in life where you can hear about it, but until you've experienced it, you don't really understand the gravity of like when
Hmm.
somebody tells you about a situation like that. Like I'm going to use the word appreciate in a way where it's like, oh, like it lands differently. You
Hmm.
understand it better.
Yeah, 100%.
And actually on that note, so I unfortunately know like a few women who have had traumatic births, and I feel like one of the ways that they realize or that it validates that their birth was traumatic was when they see other people
Hmm.
having what seems like a typical birth experience or postpartum experience. Um, would you mind speaking to that a bit about like
Yes.
things that were just like made you sad or triggered you?
Oh yeah, like
Mm-hmm.
so many things. I'm glad you brought that up because that's a huge thing.
Okay.
The I would say actually the most triggering thing for me in the first maybe even like close to a year. Like
Mm.
now I think, one second here.
Okay. We are back from our quick break, and Taylor was just telling us about some of the things that were triggering for her postpartum, that kind of informed her and validated, oh, yeah, I had a traumatic birth experience.
Yeah, so I would say within almost all of the first year after my son was born, um, anytime I would like read or hear about someone's birth story that I perceived as like a normal birth story, like normal with like quotation marks around it, because who knows what that really is.
Mm-hmm.
I would get so triggered, like
Yeah.
so angry. It would send me into a spiral. It's almost like it would take me back to like the first few weeks after giving
Mm-hmm.
birth. I like couldn't help comparing myself to other people and like getting really, really jealous and angry.
Mm-hmm.
Um, and I had lots of friends who gave birth, you know, within a sort of a similar timeline that I did, like either a few months before, a few months after. And so, um, like it was happening, you know,
Mm.
it's not like I was in this like vacuum where I was the only person I knew who had
Right.
given birth that year. So like every time I'd hear a story, it's almost like I would rather not hear it. I'd
Mm-hmm.
rather just hear like, you had the baby, congrats. How are you doing? Like, are
Mm-hmm.
you okay? Do you need
Mm-hmm.
anything?
Mm-hmm.
This time is really rough. Let me help you if I can. Like, you know, I would just was like, I don't even want to know, kind of.
Mm-hmm. Mm-hmm.
Um, but I would offer like, if you want to talk about it, kind of thing.
Yeah.
Um, I even had one friend who was really, really sweet, and I had told them like, um, so glad that you're good. So glad baby's good. I I'm not trying to be rude, but I'm not going to ask you details about the story. Like, I'm
Mm-hmm.
just glad that you guys are all good. Like, not to say like, oh, at least like I wasn't doing that, but I was just like,
Right.
I just really don't need to hear right now.
Mm-hmm.
Um, maybe we can talk about it later, kind of thing.
Mm-hmm.
Um, and like, you know, because I wasn't asking for details, I'm like, maybe that person did have something that they wanted to share. So there's no like, I guess, right way to like really say that, but I
Mm-hmm.
just was feeling very triggered. Like no matter, I couldn't like help my feelings. I couldn't
Yeah.
tell myself like, oh, um, like don't be upset. It's not you. It's not your experience. Like it's someone else's. Like I couldn't like distinguish that. I would just hear someone else's experience that I would perceive again as quote unquote normal, and I'd be like so angry,
Mm-hmm. Mm-hmm.
which is silly because I'm like, no, most people like I hope they have a normal good experience. Like that should be the standard. That should not be something that is like unusual, you know?
Yeah, yeah. And I guess what I just want to validate is like, I think this is a thing with trauma where if you and I think specifically with traumatic birth, again, anecdotally from other people I know, where it's like logically, of course I'm happy for this friend and their family that they're having a baby. Like I love this friend. I'm excited that they are okay. But also that there's this like bleed over from a trauma response. It's like I'm really mad. I feel robbed of my own experience. I'm not saying that those are your words, but like from what I've heard from other people, I didn't get the birth experience that I wanted. I think that they got that experience. Why didn't I? Did I do something wrong? It just like brings up all this heavy emotion.
Mm-hmm.
And I don't know. I think it's just good to acknowledge that because I don't know anybody who's had a traumatic birth experience that doesn't have some sort of like unexpected triggering incident where
Mm-hmm.
it's like, and it seems uncontrollable. Like again, not an
Yeah.
expert and haven't lived through it, but on the outside I'm like, yeah, it's just where it's just like boom, I'm mad now.
Yeah. No, that
Mm-hmm.
would fully happen. Like, and it would make me upset because I'm like, why am I mad? Like, there's
Yeah,
nothing to be mad about.
you're like, now
Like,
I'm mad that I'm mad.
yeah. Like, it doesn't even make sense that I'm feeling this way right now.
Yeah.
Um, because I feel like before having a child, I'd be like, please tell me your birth story. Tell me everything, you
Right.
know? Like, I
Yeah.
want to know everything.
Right.
Now I'm like, please don't tell me. I can't handle it. I'm
Mm-hmm.
getting to a point though where I'm more okay with talking about certain things, and I haven't gotten angry like that in a while.
Mm-hmm.
Um, So I think that's good.
Mm-hmm.
It's good progress.
Yeah. Yeah.
Yeah.
Well, I feel like, yeah, that's, to me, that's like could be like an indicator of healing and, continuing to live your life. But I also think that it's important for women like you to speak up and say, like, I had this traumatic experience, because then other people who have experienced it might be able to reach out to you, be like, I don't want to talk to these normie birther people that had normal births, but like, I think you're going to understand what I'm talking about. um I hope that makes sense.
That does make sense.
Anything else you want to say on that topic, or like, if you have anything to suggest in terms of people who are going through this, that are still in that season where it's like everything hurts. When I see a baby, it makes me sad because it reminds me of my traumatic birth. Like, anything to offer up there?
So, I mean, in one way, I did talk about social media a little bit and how it was like harmful in some
Mm-hmm.
ways, setting up my expectations. Similarly, though, it can be helpful when you're going through those emotions. Like, I found a lot of community by looking for people who had similar feelings, like on Reddit, for example, or on the What to Expect app, looking at people who also had a traumatic experience. Because I think when I was going through that, all I wanted was I just wanted to meet someone in the wild who also had a crazy experience. Like,
Mm-hmm.
I was so sick of meeting moms in the wild who were like telling me their birth story that sounded completely like something I would have wanted.
Yeah,
You know what I mean? Because I'd be like,
totally.
oh, that's what I wanted,
Mm-hmm.
selfishly. Um, all I wanted was just to meet someone who's like, hey, I also had a crazy experience and it was the worst.
Mm-hmm.
And I could be like, wow, let's talk about it. So when I couldn't meet those people just out in the world, then I looked specifically um, for those types of stories online, and I could see what other people were saying and then see the replies and the comments. I think Reddit is a pretty good place for people who know generally know what they're talking about to
Mm-hmm.
discuss the topic. I know that's not always true, but certain communities, people seek them out.
Reddit can be a good place to be, and I've used it this way to be like, hey, I'm having this experience. Anybody else experiencing this too? And I feel like I remember you telling me that you had maybe had a similar thing with
Mm-hmm.
Reddit. Yeah. Do you mind just
Yeah.
sharing about like what that was like for you to share? You don't have to be like get into specifics, but
I think it was, I can't remember if it was on Reddit or on What to Expect, but I shared a story on there. I think I wrote out my birth story, not like in as many details as I told you probably,
mm-hmm.
but the higher level. Um, and I was like, not looking for advice, just putting it out there. And people's responses were encouraging, like knowing that other people had maybe somewhat similar situations. Often, actually, people would reply and tell me about what happened to them, and it was kind of similar, but even worse,
Mm-hmm.
which is not good to hear, obviously. But then it also gave me perspective of like, wow, like
Yeah.
what I went through, I thought was like very challenging. And like this person did that plus more. Like it's just interesting to see what other people's experiences are and helping me sort of like understand that I don't need to feel isolated and alone about
Yeah.
it. Yeah.
Because it seems like it could be so isolating if
Mm-hmm.
you don't have an awareness and you're only seeing like the highlight reel of other people's experiences.
Mm-hmm.
On that note, as a part of my research for this episode, as well as the episode about miscarriage, the March of Dimes does, for people who don't know, there's a lot of resource and support around like miscarriage, having a premature baby, and also birth trauma. And one of the things that they recommend is doing what you did, which is like writing out your story, whether it's
Mm-hmm.
like in full or part. And I can make sure to link to this guide that they have, so that just saying, like, even if you're not wanting to go post that somewhere, they suggest that as just like a therapeutic practice for people building their own narrative about what happened to them, because it's such a,
Mhm.
from what it sounds like a very disempowering experience where it's like, even though like you said I had choice, I had agency, some people don't feel that way, but then when you
Mhm.
like take it and you write it down and you process it, or and then like with your experience of posting on Reddit, and then you're getting encouragement, validation, and perspective, just seem it's just they know what they're doing, and it seems like a good suggestion for anybody who's thinking about like, how do I process this.
Right.
Mm-hmm.
Yeah, I definitely think writing about it and talking about it with people who I felt could understand was like a huge thing for me. And I did have one friend the friend who I was talking about, who sent me those materials right when I got home from the hospital. She had had a similar birth experience, and like talking to her was one of the most helpful things, I think,
Mm-hmm.
because I had known snippets of what happened to her, but not in full. And then when I shared what happened to me, she's like, "That's literally that was my
Wow.
life. Like that's what happened to me."
Yeah.
Very similar, of course, slightly different because they're all different, but that was super helpful just to not feel
Mm-hmm.
alone. Because like
Yeah.
everyone who has a child is definitely not alone, but it
Mm-hmm.
feels so isolating. It's the weirdest thing. It's like, welcome to the parent club. Like you get like this is like a special club that not everyone gets to
Mm-hmm.
be a part of, and so you're
Mm-hmm.
like, okay, I'm being welcomed into this community, but at the same time it's so isolating.
Totally.
It's like this weird dichotomy.
Well, and I mean, I didn't do any research on this. For what it's worth, if there's any dads out there or non-birthing partners out there who have had an experience where their partner had a traumatic birth, I would love to talk to
Mm-hmm.
you. But I would imagine that there's like you and Corey, you've been together so long, and then you're pregnant, and like he's still part of the pregnancy and like very supportive partner, but like I would imagine that would feel like like it's just different. Like it's just different. And then even though he
Mm-hmm.
was there the whole thing, it's like I would imagine that it's maybe a bit of a challenge in terms of like I am just like alone in my head, even though I have baby here and husband here. I'm not trying to put
Mm-hmm.
words in your mouth, but like it's like even though somebody's there, they're not experiencing like that physical level of trauma to do basically all the pushing of a vaginal delivery and then to have a C-section. Am
Mm-hmm.
I making sense with what I'm saying?
Yeah, yeah, no, totally.
And
Also think that
mhm.
partners, like I think non-birthing partners probably also feel super isolated,
Yeah, and probably
like
helpless too, where it's like
so
I can't
isolated.
do anything.
Yeah, no, for real.
Yeah, that has to be really, and I bet there's even less forum for them to talk about it.
Mm-hmm. Totally.
So if you're out there and you're listening, you and you're one of my few male listeners. No, but like truly, I think that that's one thing that our generation of men is doing. They're doing a lot better. They're a lot more active in showing up for their partners as a part of pregnancy and postpartum care.
Mm-hmm.
But I feel like we don't create that type of space and community for
Mm-hmm.
men non-birthing partners.
Totally. I agree.
Mm-hmm. Was there anything else you want to chat about, Taylor?
Um, I mean, I guess I would just say I would add, because I've talked so much about social media, I will give you suggestions for really helpful accounts that I think are good ones to share in the show notes. But
Perfect.
I would say if you notice that if you're pregnant or if you're newly postpartum or thinking about becoming pregnant, um, and so you start following accounts online, I would just like pay attention to your feed, your algorithm. I would try as much as you can to not get so entrenched in that world, which I know it's super easy to get entrenched into that when you're excited about becoming a parent. Like it's so easy to get stuck in there.
Mm-hmm.
And there is some helpful stuff, but I will say that having all of that on my feed coming back from the hospital, for example, was and like in the state that I was in was very harmful in a lot of ways
Oh
and not
yeah.
helpful. So if you are a person who's on social media and those other things apply to you, I would say maybe like, I don't know. It's easy to scroll on your phone when you're just like sitting and you're breastfeeding or feeding from a
Mm-hmm.
bottle, your baby, whatever it is that you're doing, they're sleeping on you. it's easy to just scroll on your phone, but if at all possible, maybe find hours to like literally put your phone away, delete the app for like a few weeks. Like, I don't know, just like
Yeah.
protect yourself as much as you can. Um, because it's really like the internet scrolling, the spiraling about like things that I would just like search on Google. It was so bad. It was so bad for my mental health. And that might not be the case for everybody, but I have talked to a lot of parents who feel the same way. So I don't know. If there's a way to
Mm-hmm.
protect yourself from yourself on the internet,
Yeah.
then please try to do that. With the exception of, things that bring you joy. Like if you're
Mm-hmm.
using the internet to distract yourself and you're like watching funny cat videos or whatever, like that's cool. But like, let's be honest, that's probably not going to be the only thing in your feed.
Mm-hmm. Mm-hmm.
Like instead try to find like like watch your comfort show. That's
Yeah.
mindless that you can just have on. Like you're like, oh, I hear Leslie Knope's voice. Like
Yes.
she's my guiding light.
Yes. 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 Yes.
That's the advice that I would give if that is something that sounds like it might work for you if you're listening.
That is great. I'm glad that you said that because that does bring up another question that I wanted to ask you. I know you already mentioned you had a friend who sent you what sounded like a fabulous care package that was really helpful. What were some
Mm-hmm.
other things that you found helpful in terms of
Mm-hmm.
support that you received that listeners like me who, maybe will never experience pregnancy, but like want to be good community members and good
Mm-hmm.
friends? Like what are words that you have for those people?
I definitely think like food um, was super helpful. We didn't get like a ton of homemade food, which was fine. I don't expect people to make us homemade food, but we did get a lot of like DoorDash credits, which we used for a very long time. And that was great because even when I was physically well enough to leave the house, like just the thought of leaving the house to go somewhere to get food was very daunting. So that was
Mm-hmm.
great. But then I also did have some people bring homemade food, which is of course like the holy grail. Like that's amazing. But I again can't expect adults with busy lives to always have time to do that. So if you were one of those people who sent me those goodies, like just know you are in my heart forever. It's like the best thing
I
ever.
love that. Was that
Yeah,
through a
so
meal train? Was it like organized?
it wasn't organized. I would say having a meal train, organizing meal train would be super helpful. That would be cool because it was just done out of the kindness of people's hearts, which is great. But it would be cool to be organized as well. And then the other thing I will say, if you really want to be helpful to someone who's in the trenches like that, instead of coming over to like meet the baby, which is what you want to do, right? Because you're like, can't wait to meet the baby. We all know that's why people are coming over, like obviously. But instead of leading with that premise, say, hey, I want to come over and do dishes. I want to come over and do laundry. And
Mm-hmm.
then, of course, naturally, while you're there, you're going to see the parents, you're going to see the baby, and you can say hello to the baby and meet the baby. But
Mm-hmm.
also know that, like, a lot of parents, specifically moms or the birthing partner, are like they might get anxious trying to like give their baby to someone else to be held. Like there's
Mm-hmm.
like a physical pull between the birthing parent and the baby, so like that can be stressful. So instead of like just coming over and expecting to hold the baby,
Mm-hmm.
just let it happen naturally. If the person says, do you want to hold the baby, and you want to hold the baby, then like cool, you can do that. But don't come over and be like, can I hold her, can I hold him, and
Yeah.
like, oh, I'll hold him while you do something else, because like chances are the birthing parent doesn't want to do that.
Okay. Yeah.
Yeah.
That's a really that's great. Thank you. Thank you for saying that. I saw something online recently where it was also like suggesting that friends have a almost like a menu of like, all right, you're feeding the baby. I can start a load of laundry,
Mm-hmm.
wash your dishes, clean out your refrigerator. Which of those things do you want me to do right now? Instead of it being like, what can I help with? Like come with
Right.
some specific things where it's like,
Yes.
I'm just gonna do it.
Yeah,
So
if
just
you
tell
say
me.
like, what do you need, or what can I do, like my response would probably be like, I don't know.
Yeah.
You know,
Nothing. Don't worry.
yeah,
But
it's
yeah,
fine, just go
it's
sit
fine.
over there.
Yeah. But just to let the person Let get on their terms, dictate what could be helpful. Mm-hmm.
Exactly. Yeah.
That's good advice, because I will also say, by the time you had your son, I had a couple friends where, like, the first couple times I was just like, the baby's here, I'm gonna sit here, and like the postpartum friend
Hmm.
is running around and like doing their own dishes and stuff. But then I had a girlfriend who was like, oh, it would be helpful is like not doing that. She like came in and I was
Yeah.
holding somebody's baby. Literally, she was like, oh, you come over, you sit with the baby. And I was like, just right now. She was like, oh, I'm more the kind of friend where I start doing laundry and stuff. I'm like,
Yeah.
oh, that sounds way more helpful than me just like taking up space on the couch.
And
So
I mean, some people might want you to hold the baby because they just need a break. So that's also valid too. So if you just kind of like let them
yeah,
dictate like what they want. Another
yeah.
thing a friend of ours did that was super helpful was because we went to the hospital and didn't know how long we were going to have to be there. Um, at the time we had a cat and like didn't plan for how long we'd be gone for her to be fed and stuff. So he came over, fed the cat, and then that's all we asked for him to do was just feed the cat. But then he ended up like cleaning the kitchen and like putting stuff
So
away
nice.
because like it was a huge mess because the day we left for the hospital, I was like a mess. And then Corey was also like trying to figure out what's going
Yeah.
on. So that was super helpful too.
Mm-hmm. Oh, I love that. That's such a good one.
Yeah.
Awesome. Well, are you ready for me to ask you my three end of show questions that I ask every guest?
Let's do it.
Let's do it. All right. Question one, Taylor. If you could go back to right after your son's birth, what would you say to that younger version of yourself?
Um, so we didn't even talk about this, but I'm gonna reference her here, so that's why I'm saying this.
Okay.
I ended up going to therapy for a while to like sort out
Oh,
all of
good.
these
Yeah.
feelings and stuff. So I
We're
would also
so pro
recommend that.
therapy here. Yes, yes,
Yes, we
yes.
love therapy.
Love it.
But one of the things that my therapist told me that, and this is what I would tell myself at that time, is that you gave birth to your son.
Yes, you did.
There's no other like um questions about it. There's no like but there's no,
Yeah.
asterisks. It's just like you did this.
Yes. Oh, I love
Um,
that.
and even if you like had a planned cesarean, even if you had an emergency cesarean where you like literally weren't even physically, I mean, mentally aware of what was going on because you were under general anesthesia, like that all counts.
Hmm.
Like you gave birth, you did it.
Oh, I love that. That's so affirming.
Yeah. Cause like your body went through it, you did it.
Yeah,
Doesn't matter
absolutely.
how it happened.
Cesarean birth is birth.
Yeah, exactly.
Period. Yeah.
Hmm.
I love that. Question two. What has been the most helpful tool or resource in navigating your recovery?
Um, I just think talking to people about it who can
Mm-hmm.
understand. So whether that's a therapist or a friend or family member who either understands what you went through because they had an experience like that, or maybe they're just an understanding person who's not going to provide any judgment in any sort of way. I think that's really helpful.
Great. That's a good one. Okay, third and final question. If you could say anything to someone out there who is relating to your story, what would you tell them?
You are not alone.
Mm, that's right.
Yeah.
You are not alone. Yeah, 45%
Hmm.
of births are traumatic.
Yeah.
Mm-hmm.
I was just talking to a friend um, who also has a son, and we were just sharing like we're like, are there people out there who have had like zero trauma in their birth? Because I feel like there's always like maybe some degree, some level of like, oh,
Mm,
this is a new experience. This is not what I was expecting. I feel like there's always going to be some degree of maybe not necessarily trauma, but something that you weren't necessarily planning for or expecting.
mm,
Um,
that's a good point.
yeah, because you never know. You never know.
True.
Even with a positive experience, like I've talked to people who had an extremely positive experience and they still had something where they were like, well, wasn't expecting that, but
Right.
overall glad it happened that way or whatever.
Yeah.
So you're definitely not alone. No matter what your birth experience is, you are not alone. Someone else has been through that.
Mm-hmm.
Mm-hmm.
Yeah, so true. Well, thank you so much for being my guest on Uniquely Qualified. And thank you to our listeners for tuning in. If you don't already, please follow us on Instagram. Our handle is Uniquely Qualified Pod. And as we also mentioned, March of Dimes suggests that people who have had birth trauma write out their story or talk about it with somebody. So if you would like to share space and email me, you can email me at uniquelyqualifiedpod@gmail.com. I'd be happy to just listen. I'd also be happy to host you on the podcast if you'd like to share your story as well. Um, Please also follow us on Spotify and stay tuned for other episodes about people sharing their experience, strength, and hope in overcoming life's challenges. And just remember, as you go through the rest of your day, we are all uniquely qualified.